Okay. All right. Welcome, everybody. We're going to go get started here in just a moment. Thank you for joining us this morning. And again, we're going to be sharing live on Facebook as well. I'll go ahead and add my own camera. Okay. So today is May 9th, Saturday, May 9th, virtual town hall. We'd like to welcome everybody on the call, and we've got a few more people that are going to be adding in. And of course, we are live on Facebook this morning. And I would like to welcome our special guest to our town hall. He is the Contra Costa Health Officer, Dr. Chris Farnitano. He's going to be joining us today to talk about some of the different orders and all of the different things that are affecting Contra Costa County specifically. We kind of feel there's definitely been a few disconnects in understanding some of the information that is out there. And so we wanted him to come on today to help us just better go through a lot of that information. And so there is a little bit of a different format today. I just wanted to make everyone aware. We are not going to be taking any spoken questions from the audience, only because of time. We do have a number of pre-prepared questions that a number of us are going to be asked between Visit Concord, the Chamber, and the City of Concord, and myself will be asking a number of different questions. But if you do want a question asked, you can go ahead and put it in the chat. And then if not, go ahead and put it in the chat on Facebook as well. We'll try to get to as many as we can, time permitting, but we are trying to keep this to roughly 45 minutes to an hour today, to respect Dr. Farnitano's time. So we're going to go ahead and just kind of go through, of course, everybody's used to the first few things that we can always kind of go through. Hopefully everybody by now is familiar enough with Zoom. Everybody is on, any participant at this point that is in, just so you know, you are on mute. That's on the Zoom call. So that has been, all of the audio has been disabled at this point in time. So again, you'll need to do a chat if you have any questions as we go along. Of course, your videos are live. And then of course we are on Facebook Live. So like every single call, I always like to start off with just the stay home and stay safe. And thank you to everyone that's out there. Thank you to those who are staying home. Thank you to those who have stepped up to volunteer. Thank you to those who have made donations. And thank you for Concord for doing your part. And as you can see, I think that everybody's done a good job, and the goal is just continue the good work that everybody's doing. We also want to continue to thank our essential workers. Thank you to everyone. Thank you to Visit Concord. Thank you to the Chamber, and also another sponsor, Pacific Service Credit Union, who have sponsored a number of these banners that have gone up around town, and hopefully help just to kind of brighten some people's day and say thank you for what you're doing right now. So what I'm going to do is I am just going to do a really kind of quick kickoff of some of the current state home orders. I just want to make sure this information is out there right before Dr. Farnitano speaks. But of course, the orders were updated. Everything is still through May 31st, 2020, unless amended by our county health officer. And so the health orders are still in effect as of May 4th. There were no changes. And so those are some of the things that we're going to go through, because again, we feel there's a little bit of kind of some misinformation, not necessarily misinformation, but just there's a lot of information coming in, and certain counties may be doing certain things and we're not. And so that was really the point of today's call. But as of the order stood from May 4th, these are the big things that of course got opened up, that are of course with limited, per guidelines. So as you can see here, between construction, commercial real estate transactions, there is I think there's still some more to be done around trying to understand the things around childcare, summer camps, schools, recs, and I think we'll even maybe talk about that further as we go. And then of course outdoor businesses, landscape, nurseries, and then if you so need to move, you can do that now. And then the final piece is recreational activities. Again, we're going to ask more about that as we go, but a few elements of some of the recreational activities have opened up over the course of the last few days. So those are things that are just now going into effect. So with that, I'd like to go ahead and welcome our County Health Officer, Dr. Chris Farnitano. Thank you so much for joining us today. And please, the floor is yours.
Thank you. Thank you very much for having me today. I do want to really make clear that there has been a lot of news at the state level about the state's plan to move to what they're calling a soft stage 2, which is allowing some drive-up retail. But the governor has made it very clear that local orders, when they are stricter, do take precedence. And the governor's made it really clear that we have a very, very diverse state, and that different pace of opening is really appropriate for different parts of the state. Rural parts of the state that have very few cases, really, and a very spread out population, really can open up at a little bit quicker pace than some of the more dense areas like the Bay Area and like Los Angeles. And so the Bay Area health officers have really been working in concert together. The large counties, including Contra, Costa, Alameda, San Francisco, San Mateo, Santa Clara. And we've been working real closely because the Bay Area is one human ecosystem. There's so much work and travel and shopping and other interactions across the Bay Area that what happens to one county really affects the other. So we've been trying to make these decisions in concert as much as possible. And so this past Monday, we did make a change and opened up most construction, most outdoor work, and a lot of retail, a lot of outdoor recreation. And so we want to really see the effect of that. We put out a metrics paper last week saying that we were going to look at 5 key metrics that would let us know whether we are prepared to open up the economy more and loosen some of these restrictions. And we're going to be following those, and we're going to be looking at those over the next few weeks to determine whether it is safe for the Bay Area to start opening up some more curbside retail. Currently in Contra Costa County, we have 1,014 total cases. We're getting about 15 to 20 new cases a day. We have currently 16 people with confirmed COVID-19 in the hospital, and we've had so far 29 deaths. We are really starting to test a lot more. We are really opening up more testing sites, both run by the county. We've got some state testing sites, and we're also really working with all our community partners like John Muir and Kaiser and Sutter to try to increase the amount of testing. We know that back in March, there were many people who had COVID-19 or coronavirus who were not tested. We estimated that for every positive test, we probably had 10 community members who had coronavirus that we were not picking up because there was such a shortage of testing. Even now, as we've expanded our testing, we think there may be 2 to 5 cases that we're not picking up for every case that we are. And so we really need to rapidly improve the testing. We opened up our testing sites for anyone who wants to test, whether they have symptoms or don't have symptoms. And regardless of what insurance they have or no insurance, we're offering testing for everyone. We have a site in North Concord that's drive up. We have a site in North Walnut Creek that's a walk-up site. All of those can be accessed through our appointment based testing. There's a phone number, 844-421-0804. Again, that's 844-421-0804, and people can call and schedule a test. And again, whether they have symptoms or no symptoms, we want to do more testing. We especially want to test people who are out in the community. So if you're an essential worker, you're working at Safeway, or you're working at Home Depot, or you're working at a gas station, and you're out interacting with the public, we especially want to test first responders and healthcare workers who are out there. We especially want to test folks who are working with the elderly. So nursing home staff, staff who work in elder care facilities, those are our most vulnerable parts of our population. So with the people who are working around them, who are out in the community going shopping and then coming to work, we want to test them so we can pick up these cases. As we know, there's a lot of asymptomatic cases, and we know that even before someone develops symptoms, they can pass this virus. So we want to pick things up before somebody gets symptoms so we can have somebody isolate themselves, separate themselves from the public, and not spread the virus further.
Okay. All right. Oop. Do you want to move to the next slide at that point, or?
Yeah, let me go over the
Okay.
the indicators. So the indicators, and these are all the Bay Area health officers across the Bay have agreed to these indicators that we're going to track. And so the first indicator is that we are the total number of cases is flat or declining. And we are seeing that in Contra Costa County, that the numbers, we were getting 40 cases a day a few weeks ago, and we're getting, 15 to 20. It's been fairly flat for the last couple of weeks, but the numbers have been flat or decreasing. So that's an encouraging sign. The second indicator is that we have sufficient hospital capacity to meet the needs of our residents. And we're measuring that by, we need to reserve at least 50% of our hospital beds and our ICU beds for non-COVID patients, because hospitals still need to do all those other things that they do, including elective surgeries, treating heart attacks, treating strokes, treating people with cancer, all those other things that hospitals do. They need capacity for that. And so our hospital numbers have been declining. We were averaging about 40 hospitalized patients each day in our area hospitals throughout the county, and now we're around 20. So that's improving. And those two metrics were really key to where we made the decision to this past week to open up on the construction and outdoor work and outdoor recreation. So it was a small step, but an important step, and we felt we had made some progress. The other metrics include, are we doing enough testing? And based on many different expert opinions, the need to do more testing to really detect not only the symptomatic individuals, but also asymptomatic individuals who may be passing this virus. And we need to test in Contra Costa County about 2,200 tests a day. That's about 2 per 1,000 population. And up until this past week, we were only testing about 30 tests. About 300 tests a day. We've actually increased that in the last week. We were testing about 400 to 500 tests a day, but it's still below that 2,000, 2,200 tests we need to get to. As we've increased our tests over the last week, our numbers have gone up a little bit, and that's a good thing that we're finding more cases, but it's also a sign that we were not doing enough testing before, and we still have a ways to go. So we've been adding more testing sites. We now have 9 different county or state-run testing sites throughout the county, and John Muir and Kaiser and lots of other providers are also doing a lot more testing. The testing turnaround times are a lot quicker now. That we're getting results often in 1, 2, or 3 days. So that's much improved from where it was a few weeks ago, where it's sometimes taking a week to get your test result. The fourth indicator is that we have sufficient case investigation and contact tracing and isolation and quarantine capacity. And this is a fundamental type of work that public health departments do every day, but we've never done it on this kind of scale before. So we've had a measles case or a tuberculosis case in the past, and we've reached out to those individuals, identified who their close contacts were, make sure that individual and their close contacts can isolate themselves from the public to prevent spread. Something we've always done, but never on this scale with this pandemic that we're facing. So we've already quadrupled the staff at the health department that is doing this work, but we need to quadruple it again, and we're working quickly to ramp up that staff. We've partnered with UCSF to do a training program for new staff on how to do this and do this work effectively and well. And we're partnered with the state on a software that helps us efficiently and reliably track all these cases and all these contacts. But it's a lot of one-on-one work. It's picking up the phone, it's talking to someone individually, making sure they understand their instructions, talking to them about the people they may have been in contact with, then reaching out and trying to identify those people and find them and talk to them. So it's a lot of interpersonal relationships. There's a lot of trust necessary to get people to cooperate with this for it to be effective. Our goal is that we can reach 90% or more of the cases, we can reach 90% or more of their close contacts, and that we can assure that at least 90% of the cases and contacts can isolate themselves either in their home, or if they don't have a home or their home is a group setting or a setting with a lot of vulnerable individuals, say you've got some elderly relatives in your home, you may need to isolate somewhere else. So we're building the capacity to have hotel rooms and other places for people to stay if they can't safely isolate at home. They're putting others at risk. The final indicator is that we have at least a 30-day supply of personal protective equipment available for all healthcare providers. And so that means the masks, the gowns, the face shields, all those things that medical staff, healthcare workers who are working around coronavirus patients need to wear to protect themselves. We know that healthcare workers are at risk, and throughout the world and throughout the country, we've seen so many healthcare workers get sick just by coming to work each day and trying to do their job. And there's been tremendous shortages throughout the country on this type of protective equipment, and we want to make sure we're not opening up the society too quickly, leading to a surge of cases that the healthcare system's not prepared to take care of while protecting their workers. And these last couple of weeks, a lot of healthcare systems and medical offices and dental offices are starting to resume routine healthcare. A lot of that was postponed at the start of this epidemic, and now we were wanting to get back to a lot of that routine care, because it's okay to put off your mammogram for a month or two, but it's not okay to put it off for too long, or put off your blood pressure checks or your diabetes checks and all those other things. So as those things are ramping back up, they're also in need of this equipment. So we want to make sure that the pipeline for this equipment is getting better, but I still hear reports of dentists and medical offices who aren't able to obtain the masks or aren't able to obtain the face shields that they need. So we're working and we're checking in with the hospitals and the nursing homes on a weekly basis to see whether they have all the equipment. We're still getting requests for equipment to our emergency operations center. So that's something we're not there yet, and we want to get there before we do a real full-scale opening up of the society. If you want to move to the next slide. So this is just the number of new cases reported in the county, and you can see it really did drop until about the last week of April, and that's a real testament to the community following the stay-at-home orders and really maintaining 6-foot distance and face coverings and really staying at home as much as possible. We've seen a flattening since then, even a slight rise in the number of cases. Some of that may be because we have increased the testing over the last couple of weeks, but that again is a sign, reason for pause that it tells us we weren't doing enough testing before, and we need to do a lot more testing so that we can really have more confidence in these numbers, so that if the numbers go down, it's a real reflection of cases in the community going down. If the numbers go up, it's a real reflection of cases in the community going up. You can go to the next slide. So this is there it is. So this slide shows the number of new tests we're doing. So you can see the bar at the top is the target. We want to do, about 200 tests per 100,000 residents, with a population of this county about 1.1 million. That's about 2,200 tests. Currently, we're doing about 40 to 50 tests per 100,000. So we're about, a quarter of the way to our goal, but that number is coming up quickly, and we're adding more capacity. There was a lot of shortage of the swabs that to collect these tests, a lot of shortage of the lab machines and the reagents in the labs to run these tests. Those shortages are getting much better. Now it's really more ramping up the people power, the healthcare workers that are collecting these specimens, setting up sites in every neighborhood so people have access to these tests, so we can get up to that target of 200 tests per 100,000 residents. And we really want to focus a lot of that asymptomatic testing on the people who are more out in the community, the essential workers, the healthcare workers, the first responders, the folks who are working with the elderly, because we know that the elderly who are in nursing homes or in assisted living facilities, they're sheltering in place. They're not going out in the community, but they need care brought to them. So there's personal care workers, there's people bringing them food, and those folks are out in the community. So we really need to protect our elderly. We have to protect those workers. We have to test those workers. We have to test the folks who are high contact out in retail, so that we can identify those cases early before there's a lot of spread. You want to go to the next slide?
Actually, that was your last
that was my
slide.
last one. Okay.
Yeah. So, no, perfect. And thank you for kind of going through kind of a general idea of what are some of the indicators we're looking at. And so what I want to do is just kind of follow up on the first few questions around testing specifically, because there's definitely, that's the biggest interest at the moment. You mentioned there's 9 sites throughout the county, but of course there is one in Concord. And one of the questions that kind of comes up is, so it's in North Concord, but we know that there's definitely specific areas that have, higher density populations. And in some cases, a lot of those people don't necessarily have the ability just to get in the car and drive to an area that doesn't maybe have the same kind of transit lines. So has there been talk about trying to then also bring some more localized testing to some of those areas as well? What does that look like?
Yeah, absolutely. So we're really looking to try to find a site in South Concord, so we can add another site there. We do have the walk-up site. It's over by Heather Farms, and so that's at least somewhat close to South Concord. All these sites are by appointment only, so that's really important. Don't just walk over there or drive up over there without calling first. We're doing it all by appointment. We also developed a mobile team for facilities. So if we have a case in a nursing home, we can go there and bring our testing staff to a nursing home and test the staff and residents there. It's also really important that our community partners are a big part of this. So private doctors, Kaiser doctors, John Muir doctors, they've been really working together with us. We've been partnering with them in going out to elder care facilities to help them with their infection control practices, review their PPE, mask, and other protective equipment supplies, make sure they have enough, make sure their staff knows how to use it. We're also now working with them on arranging testing for all these facilities. So our goal is to really, for these elder care facilities, to test the residents and the staff on a monthly basis. So whether there's been a case in the facility or not. And over the next few weeks, we're really going to be going through step by step through all these facilities and trying to get everybody on a regular testing schedule. But the health department isn't going to be able to do that alone. So we're really working with our partners, the large health systems like Kaiser and John Muir, to try to develop this testing program.
Okay. So, you know, because we definitely have a few places of particular that we could have testing centers throughout Concord, especially some of the areas we're talking about.
Mhm.
What would be a good process to follow up with and try to see if we can even have that be one of the centers or testing site in Concord? What would that process look like? Who would we follow up with to do that?
You can follow up with me afterwards. We've got a testing task force, and I will put you in contact with the leader of our testing task force, and they're the ones who are, you know, working to try to find these sites. So we'd love some help with that.
Okay, that would be great. And I'm actually going to specifically call Mining Impact. I know that Deborah's on the call as well, and so what we'll do is hopefully that could be one of the sites just because of its proximity. So that'd be perfect. But we'll talk more. That'd be great.
Okay.
So let's go ahead, and one other thing, if you don't mind, just touch on right now that kind of final disconnect between kind of what Governor Gavin Newsom's saying and Contra Costa County. So I know you kind of went through that. What do you think our phased-in approach is going to be over, say, the next 2 weeks to 4 weeks? Like, kind of that whole what should we really be expecting at this point?
Well, the Bay Area counties are really trying to work together as a whole. And we just made that change this past Monday, and we really want to give 2 or 3 weeks to see the effect of that change. The governor just put out its new state order yesterday in writing, so we've all been looking at that and studying that and seeing the exact details, because you know the devil is in the details. And we're going to be looking at that and looking at the data, because we really want to be driven by the data and the science. And in 2 or 3 weeks, if we are still making good progress, strong progress, our numbers are still trending down, and we're getting closer to meeting our goals with our contact tracing and testing, we're going to consider some further opening up of the restrictions. The governor really framed this moving to phase 2 in really 3 categories. There's the overall state move to phase 2, but then also realize that there's some rural counties that have very few cases and are very spread out, could move even faster than the state, but they have to certify a number of requirements that they are safe to move faster than the state. Those requirements include having a low number of total cases, not having any deaths from COVID-19 in the last 14 days, that they're testing close to that 2 per thousand rate, so that they're going to be able to detect cases in their community. So some of the small rural counties may be over the next month moving in that way. But then the governor also recognized that more urban counties may be moving a little bit slower than the state order, and totally recognize that the denser counties have more cases. They also have a denser population, so there's more risk of spread. For example, Los Angeles, which has 10 times the population of Contra Costa County, they actually have 30 times the number of cases, and they have 50 times the number of deaths. So dense populations like LA, like San Francisco, they are at much higher risk and need to move slower than more rural areas of the state. But we're going to be looking at those again, the Bay Area is one ecosystem as far as people interacting a lot. So we're really gonna, the large Bay Area counties are really gonna try to move together on this. And it's going to be a step-by-step slow process. Loosen up a little bit, watch the numbers, and then if the numbers continue to be favorable, consider further loosening up.
Got it. Thank you so much. So, like I mentioned, we've got some other partners on the call as well. And so, what I'm going to do is just kind of go around and have everybody ask a few of the different questions. I'm going to start off with Valerie Brony. She's our city manager, but on behalf of also our economic development department, we've got a few questions we wanted to start off with. And then after that, we'll followed by the Kevin from the chamber or Melissa, but and then Elaine from Visit Concord. So, Valerie, you want to go ahead and
Yes, hi, Doctor. Thank you so much for joining us and allowing us to ask some of the questions we're receiving at the city.
You're welcome.
So the first question is, will the county provide guidelines to individual sectors such as restaurants or retail, or should businesses expect to rely on the state guidelines for their checklist for when they reopen?
When the Bay Area first put out its stay-at-home orders, and the Bay Area really was one of the first parts of the whole country that put these stay-at-home orders in place, and doing it first is really a big reason for our success. We really had to develop these guidelines on our own. Even when the state came up with their first stay-at-home order, it was very non-specific, and there weren't very clear guidelines for different sectors. The states now really made a lot of progress with that, and they've come up with this roadmap to recovery, which you can find. I think the website is coronavirus.ca.gov, and in that document they outline very detailed guidelines for different sectors of the economy, including sectors that aren't allowed to open now, may be part of later phase 2 or even phase 3 or phase 4, but they're very detailed guidelines, and they are very helpful for businesses to look at to help prepare for that day when they will be allowed to reopen. Now that the state has these guidelines, we're going to be really using those as a guide. For the most part, we'll be following those sector by sector guidelines. We may reserve the right to put some additional requirements if we feel that the state guidelines aren't strict enough, but those are really a good starting point at this point. They've only been out for a week, so we're still studying them, but they seem to be very thorough, and I think that's really what we don't want to have. Too many different guidelines from one county to the other, and we've had some of that because each county has had to kind of go on their own. But now that we do have kind of a state templates to use, we're going to try to get more consistent so that businesses can follow the same guidelines if they work across multiple counties.
Well, thank you. And that's actually helpful to know as we work within our business community to prepare for when we do start moving into our soft phase 2. So another question we get is, we're seeing programs like Barbicide COVID-19 certification, which is a certification program to ensure barbers and salons are safe under this new normal that we're experiencing. Should we expect to see businesses needing certifications like this in the future? Or will being certified in the future help them to open up sooner?
It's hard to say for sure at this point. I would again refer to the guidelines that the state has now. We did put in guidelines for construction when we opened up all construction this past week, and for large construction projects there was a requirement that they had to have a safety individual monitoring their construction project that had to have a certain certification. So there is some precedent for having certain certifications, but the barbers and haircutters, currently the state has them listed in phase 3. And so it may be a little while before they're allowed to operate, but they do have guidelines for them. So I would refer people to look at the state guidelines currently to see if there's any specific requirements. I can't off the top of my head recall whether there's any certification put into the state guidelines at this point.
Thank you. So at the city, we regularly get calls, as I'm sure the county does, from businesses wanting to open and not understanding why their particular business can't open, even though a similar business is open under the county's orders.
Mm-hmm.
We are also seeing now, for instance, this week was really tough because the state order was different than the county order. And so a lot of businesses were relying on the state order, given all the press that received. On top of that, the newspaper this morning talked about how even within these shared Bay Area orders, Oakland and San Jose are talking about doing a soft phase 2 opening as of the 18th of this month, allowing curbside retail and some other choices. So I guess my question is, how do we help our businesses understand the rules they're supposed to be operating under? And is there a way to, if a business feels like they should be allowed to be open, for them to get clearance from the county to be able to open?
So the best way really is to go to our start with our website, which is cchealth.org/coronavirus. The actual text of the orders are there, and folks can look directly at the orders to see what is allowed and what is not allowed. We have a whole FAQ page, frequently asked questions page, and that helps clarify. We're constantly updating that with questions we get from businesses and individuals about what's allowed and what's not allowed. And we have a call center. The number's on the website, but it's 844-729-8410. That's 844-729-8410. And then that where we take questions from people who still are seeking some clarification. The call center can often answer those questions. If they can't, they often bring it to an expert so we can try to get the answer. We don't provide exceptions to the health order. It is a legal order, but we do help try to provide clarification and help people understand exactly what the order says and how it applies to their particular business.
Okay, and do you see as the Bay Area counties and cities begin to break apart, do you see that changing how Contra Costa County moves forward with the health order?
The health officers across the large counties in the Bay really are continuing to work very closely together. We do sometimes agree to disagree on minor issues, but we're really staying together on the big issues, because we know the big issues affect the whole Bay. So if Tesla starts up its manufacturing plant in Alameda, there's going to be workers traveling from Contra Costa County to work there, so it has an impact on our county. If San Francisco opens up restaurants, we know there's people going to be traveling from Contra Costa County to either work in those restaurants or dine in those restaurants. So we really do want to keep working together on the big issues while allowing some small differences between some counties which are much more dense, like San Francisco, and counties that are a little bit more spread out, like Contra Costa and Marin.
Thank you. And my last question before turning it over to Visit Concord is, can you clarify who's allowed to enforce and who is enforcing business compliance or non-compliance?
So local law enforcement is really responsible for enforcing the health order. They've taken a very educational approach in the most part, and that's been very successful. Most individuals or businesses, when they're educated about how their behavior is not in compliance with the order, are usually then following along with the order. So it's very, very rare that the local law enforcement has had to go beyond an educational approach. The district attorney is also involved through their consumer complaint hotline. So if they get reports from businesses that are not following the stay-at-home order, then the district attorney will get involved as well. But they're also taking, first an educational approach. And we really have had, extremely high level of cooperation with businesses and community members, which is why we've been so successful in flattening the curve and keeping the numbers down to this point.
Thank you.
Well, thanks so much.
Elaine, sorry.
Go ahead. And so next up we have Elaine from Visit Concord. Elaine?
Yeah, hello everyone, and thank you so much, Dr. Farnitano. This is great information. From this perspective, when do you foresee large gatherings such as events being able to return? And how would that work for like hotels where employees and residents want to do celebrations?
That's a very tough issue, because we know that large gatherings are one of the highest risk type of activities for spreading of this virus. And we've seen across the country tremendous outbreaks at large funerals, at large church gatherings, other kind of large venues. And so the governor has most of those things in stage 3, and these are the largest gatherings even in phase 4 of their opening plan. So and the state's not allowing any local area to move to stage 3 at this point. So it's going to be some time, but I know the governor as well as the local health officers, we're going to be driven by the data. How are the numbers going? Are we prepared to, are we testing enough that we can identify cases quickly and isolate people to prevent the spread? And that's going to be guiding how quickly we move through these phases.
Thank you so much. I have another question regarding the new order that allows groups of 12 in a childcare setting. So does this mean a group of 12 can also gather like at a friend's home or for a picnic?
No, those guidelines were really designed for, workers, not only essential workers, but, construction workers, outdoor workers, and including those working from home who need childcare. And so we know childcare is more than just a daycare for young children. Childcare in the summertime involves, children going to camps and other kind of educational activities. But those are high risk to get children and youth together. So we have rules around them that limit these groups to 12 or less in the same stable group of 12 children or youth, and the same stable youth of teachers or adults, because we don't want, different group of 12 each day mixing, and then that's going to be spreading the virus from one group to another.
Sure. And then maybe you could just kind of explain a little about on the risk, the stage level for community pools, water parks, dog parks, and playgrounds, some of the guidelines.
Yeah, so currently the state order does not allow those activities. Pools are really currently in stage 3, and even though a swimming pool, the water in the swimming pool has chlorine, and that we know that kills coronavirus, the area around that pool is a risk. And we know from a lot of studies when people are exercising that they're breathing hard and they can spread the virus even without symptoms much further than 6 feet. And so people in a pool who are breathing above the water can spread it to others. People gathering around the poolside, in the changing areas, in the bathrooms, in the showers, there's lots of opportunities for spread of this virus. And so that's why the state has pools in their phase 3, and the same with dog parks. Dog parks are an area for people to gather. They're often smaller areas where a lot of people with dogs gather, and we're now actually seeing some evidence that pets can pass coronavirus between each other and from a dog or a cat to a human. And so the CDC's recommendations is that if you have a pet, to minimize how much that pet is coming into contact with animals outside of your household. And so that, for that reason, dog parks are discouraged.
Yeah, this is, again, thank you for the information. One last question is, again, with your data, how do you feel like the new normal will affect outdoor recreation as we kind of have the open space, yet that's still working on our curve?
So in our latest change to the order this past Monday, we did open up certain types of low risk outdoor recreation, things like, golfing without a golf cart, tennis, things where you can maintain 6 feet of distance, and that you're not using a lot of shared equipment that could spread the virus. As we move through the phases, other types of outdoor recreation will probably be allowed. But this is one place where there's some subtle differences between the Bay Area. Some of the coastal counties really had a problem with large numbers of people traveling to their beaches and getting a lot of crowding at the beaches, so they had to close down their beaches. We've taken in Contra Costa County a little more kind of case-by-case approach. We've really empowered the organizations that run the parks, the East Bay Regional Park District, the city parks, the Parks and Rec districts, to manage things on a case-by-case basis. If there's not a lot of crowding, if people are following that social distancing, keep the parks open. There's a lot of parking lots that have been closed, and certain parks have been closed because of the concern, but it's really being done on a little bit of case-by-case basis. And the more the public can cooperate with those social distancing and avoid crowding in parking lots and trails, the more we can keep those venues open.
Thank you so much. That's my questions.
Yeah, thank you, Elaine, for that. And then next up, we have Kevin from the Greater Concord Chamber of Commerce.
Thank you. Hey, Doctor, how you doing?
Okay.
I have just some small questions, mainly probably for the audience, and I could see that we would probably need to go look at the guidelines for some of this. But for the audience, would you have a recommendation or a tip that you would give to a small business or any business to prepare for their opening and with their employees and customers? Could you give us a little advice on that?
Yeah, I would definitely recommend looking at again that state guidelines, really thinking about already we have guidelines around the essential retail, like supermarkets and things like that, about having 6 feet of spacing between customers, waiting in lines, making sure all the employees are wearing face coverings, have a written infection control plan. So I would recommend looking at the current state or the current local health order that's on our webpage, and looking at those requirements for those essential businesses that are open, as well as the state requirements, because likely especially with retail, which curbside retail is likely going to be in the next area that's going to open soon. Those are the kind of guidelines that'll be in place, so you can take steps to get ready for that in those ways. A lot of retail are putting up barriers, little transparent plexiglass barriers at their checkout stores. So consider things like that help reduce the spread, help protect their employees.
Right, so it's kind of the stuff we're seeing now at supermarkets or hardware stores is really what other businesses are going to have to prepare themselves to do as they
Yes.
let customers into their buildings.
Absolutely.
So I have a question. Like, the big calls that we get are around health clubs a lot, and which ones are going to open. And I'm sure the health clubs are probably landing in phase 3 now, but do you think there's going to be an opportunity maybe for smaller health clubs versus larger health clubs to open in different waves?
Yeah, and that's likely going to be up to the state. Currently, as you said, the health clubs are in phase 3 because they're indoors, and they are a place where large people gather. There's shared equipment. So unless the state modifies their phases and comes up with something to allow smaller health clubs to
Gatherings.
open, they're all lumped in the same category at the current time.
Okay. And then mainly for the audience, will businesses be required to check temperatures of employees and customers as they enter their store?
That's not clear yet at this point, and this is an evolving part of the science of coronavirus. And we really did institute a lot of symptom check and temperature checks in hospitals and healthcare facilities when this first started, and a lot of that was because of our understanding at that time and the lack of testing that we had. And we now know that there's so much more asymptomatic spread of this virus, and so given that, the value of checking temperatures is maybe less because we're not going to be catching as many cases as we thought through temperature checks. Hopefully, if we're doing a lot more testing too, we're identifying folks through that mechanism. So I think that's an evolving thing about whether how much real benefit we get from symptom screening and temperature checking. It's still going on in healthcare, but I think that there's a debate about whether that needs to be really extended to other areas, and if that's really going to add safety or not.
Okay. And this is my last question. What should a business do if one of their employees is suspected of having COVID or actually confirmed? Would they need to shut down, or is there a process?
There is a process, and it really starts with that individual. If they haven't been tested, the first thing is to encourage them to get tested. Once someone tests positive, the health department works with them. That's what our contact tracers are all about. So they talk to that individual. They find out, where do you live? Who do you live with? Where do you work? Who do you work with? With that employee's permission, the health department then reaches out to the employer and helps kind of identify, who works closely with them, try to get those individuals who work closely with them tested and isolated. Every business is different as far as how close people work together. So it's really, it starts with that case and the investigation that goes with that case. Generally, businesses don't need to shut down. We usually recommend kind of a deep cleaning of high touch surfaces. And so depending on the facility, they might need to shut down in order to do that deep cleaning before they reopen again. But it's really, each business is so unique. So it's really starts with the health department working with that case and doing their assessment.
Okay. Thank you. And thank you so much for all your hard work. I mean, we're ready to get back in business, but to do it the smart way. So thank you very much.
Welcome.
Right. Thank you so much. And of course, we've definitely had a few questions that have come in over the chat. And so I've got a few people kind of helping monitor that. But I had one, I'll just go and ask it right now. And I've seen this come up, and I believe actually even Nate's on the call from Sun Valley Mall. He brought this up as it related to the mall and operations, but it has to do with ventilation systems, especially in multifamily environments, and of course that being kind of a big concern for a number of members in our community in the higher density areas. And so that was something that, how is that part going to be addressed, and trying to maybe have those conversations with landlords so they know that these kind of things need to be checked. Certain levels of care need to be provided to these buildings, just for that reason, because of high density populations. What does that look like?
It is a good question, and there have been some documented cases in other countries in very small restaurants, for example, where the ventilation system was blowing from one table to the next, and they clearly saw transmission from one part of the restaurant to another that seemed to be related to that ventilation system. Most of those cases were very small, crowded restaurants. We haven't really seen in this country anything that's really been clearly documented of the virus spreading through a ventilation system from one apartment to another. most ventilation systems, even in apartments, are still aren't taking air from one apartment and blowing it into another. They're usually taking ventilation air from outside the building and then circulating it through. So the way most ventilation systems are structured, for apartment buildings, there's not really a risk of picking up virus from one apartment and moving it into another apartment.
So those that do, though, is that something to where are different checks being done, or just in case, certain, it may be an older system, or it may, it might not be a more efficient system, however it works to move air throughout the building. Are those things where will someone go check on those, or if we know that's something that is happening, what's kind of a best practice there? What does that look like?
Well, I think if there's a building where we know that the building owners or whoever's familiar with the ventilation system, knows that the system is moving air from one apartment to another, I think that's something that we want to be aware of. And if we do have a case somewhere in that building, then we want to really identify that, see potentially that person, rather than isolating in their apartment. Is there somewhere else they could isolate? Work to see about getting folks in other apartments tested as well, in case they might have been at risk for getting exposed to the ventilation system. I'm not a ventilation expert, but I'm not sure how easy it would be to modify one of those older systems to redirect the ventilation to prevent that. But I think we definitely want to be more proactive if there was a case in a building like that.
Got it. Okay. And I have just some other questions as well. There's been concern around the county that specifically it looks like the Latinx population residents, there's a higher rate of infection for one particular group over others. Are you finding that to be the case? And then also, what's the outreach looking like as it relates to kind of Spanish language, trying to reach out to those different, members of the population that are trying to get information so they can better understand what's going on right now?
Yeah, that's a really great question. We really are committed to putting all of our materials in English and Spanish, and trying to reach out to community groups that work with the Spanish-speaking and Latino population. We know that a lot of our Latino population works in very high contact types of work. So working in retail, working in construction, working in outdoor work. A lot of the allowed and essential businesses have a high percentage of their workers who are Latino. We also know that some of those residents have large families that they live together with, and so that puts a higher risk for spread. So some of those higher numbers may be because of a higher level of exposure and less ability to shelter in place if you're out there in the workforce.
Mm-hmm.
But we are we're really trying to reach out and make sure that language is not a barrier to people receiving information and receiving access to care and testing.
Okay. Let's see, Valerie or Melissa, were there some other questions that came in that I've been trying to kind of look at some of them, but were there some other questions that came up?
One question that came up, I think, was when you said that anybody can be tested even if they are not symptomatic. The question we have in here, asked a couple different ways, is should you get tested if you're not symptomatic? And also on the note of tests, somebody was asking who's paying for all of these tests and what do they cost?
Good question. So we really are recommending anyone who is at higher risk for exposure to COVID-19 to get tested, but anyone who wants to get tested, But the groups that we're really prioritizing, anyone who's been in close contact with a known case. Anyone who works in what we call sensitive occupations or settings. So those are things like working in healthcare facilities, nursing facilities, elder care facilities, working in medical care facilities, first responders, someone who's working in a group home or working with the homeless, and then folks who are working in those kind of high contact retail areas too. They're having a lot of, even though we're trying to do social distancing and people wearing face coverings, working in those kind of high public contact areas puts you at higher risk. So those are the ones we're really trying to focus our testing, the asymptomatic testing on. And then as far as the cost, the Congress did pass a law stating that coronavirus testing should be free, and we are providing at all our testing sites for anyone without insurance. There's no charge. For anyone with insurance, we are billing their insurer for the charge. We believe that most people with their insurance shouldn't receive a bill, that the insurance should pick up the full cost. But there's a little bit of lack of clarity on the federal order as to whether when people get a test outside of their healthcare network, whether they're going to get an out-of-network charge or not. So encourage people to first check with their own healthcare provider and see if they can get a test there. Again, a lot of the healthcare providers, including Kaiser and John Muir, have a lot of capacity. They can get people in for tests real quickly. But if you're not able to get a test through your regular provider, do come to one of the county-run test sites.
Okay. Thank you. Let's see here. We had, trying to look through some. Oh, I might as well ask just because in terms of a lot of our graduation ceremonies for the class of 2020, that's been a big topic of discussion that's come up. And what does that look like so far in terms of them kind of working closely with you to figure out how to kind of get these days figured out? I know that even Mount Alba Unified, I've been working with them closely about trying to come up with a plan for our graduates. And so what's kind of been the feedback so far on that?
Yeah, that's a good question because we are getting real close to graduation season, and it's been a really tough year for our seniors who've had to see their in-person schooling close down and try to adapt and adjust to distance learning and really missing out on a lot of those sort of important moments of their senior year. So we are working really closely with the school districts, working with Lynn Mackey, the superintendent of schools for Contra Costa County, and we're working on developing some guidelines around what types of celebrations, graduation type celebrations and things could occur in a safe manner. And so we're hoping to have those guidelines ready in the next week or two so that the schools can plan for some type of way to honor and celebrate their graduates.
Okay. And then I had one or two other questions, actually one more around schools themselves and what that's starting to look like. It seems like there's a lot of different opinions out there. And what's that conversation looking like as it goes into, the next academic year? What are we think we're starting to anticipate? Do we have a team kind of working on that? What do you think?
Yeah, and we've been in a lot of discussions with our school districts on this as well, and there's discussions across the region and at the state level, and it's really challenging to kind of forecast where we're going to be this fall. Folks want to plan, and there's a need to really plan not only at the elementary and secondary school level, but colleges and universities are trying to figure out what the fall semester is going to look like. And it is really challenging because we don't know if there's going to be a fall surge of cases. A lot of experts are warning that we could see a surge in cases, especially as different parts of the country relax some of the stay-at-home restrictions. And so we're trying to plan, with multiple scenarios of what could happen, and if we can allow more loosening. Right now, we're looking at these sort of childcare models of kind of small, stable groups of children as sort of a model to try to plan a redesign type of in-person learning with smaller groups. For older kids, more social distancing, keeping their desks apart in the classroom. But it's really, it's hard to know what exactly that's going to look like when we get to the fall.
Got it. All right. Thanks so much.
Mayor, I
sure.
have 2 follow-up questions I saw through the chat.
Please.
One is, in terms of the Latinx community, do we have percentages? There's a concern that there's a lot of misinformation out there about the different infection rates. And if you have that information, they are asking for you to share it.
Yes, I do. So we get on cases, we get reports, and some of the information is based on what the ordering provider or doctors collecting the test provides. So some of the information is incomplete because it's not always reported. But we are seeing that the 31% of our cases in the county are in Latinx community, and that's a little higher than the percentage in the population, which is only 26%. So it is a little higher of the cases that we're seeing, a higher rate. Again, we don't know for sure. Is that because the prevalence, there's more actual cases in the community, or maybe we're doing more testing in that community? I think the more and more we expand testing, we'll have more confidence that that higher rate of positive test results really means a higher rate of disease spread in that community. But we are seeing that. But in all our cases, 30% of the cases, the ethnicity is not reported. So it's still also a bit of an incomplete database as well.
Thank you. And then the last question comes from some of my Parks and Rec staff at the city, and they want to better understand what a small, stable child care group is if the group is 12 or fewer kids with one teacher and they meet for a week and then the next week it's a new group. Is that consistent with what you're talking about, or is the assumption they're meeting for a month or 6 weeks? Or that's the piece that seems to have stumped them?
Yeah, I mean, our strong recommendation is that these groups stay in a stable cohort for a month or longer. Traditionally, many families are used to summer camps of having children in one summer camp, maybe a band camp for a week, and then a computer camp for another week, and then a swim camp for another week, and changing week to week. And we're really encouraging camps to really restructure themselves so it's the same group of 12 or less through the same camp for a month or more, and maybe provide different type of experiences within the same camp and within the same group of 12. So while moving from one camp each week to another is technically allowed in the health order, we're really encouraging more longitudinal experiences, because the less mixing there is, groups changing every week, and so the less risk there is of there going to be more spread.
Thank you.
All right. Thank you so much. I know we've definitely run over time in terms of this morning, but Dr. Dr. Farnitano, we want to thank you so much for coming on, hopefully clarifying a number of things that are going on around our community as it relates to COVID-19. And of course, I know that you've been extremely accessible and very good with helping us answer questions. So again, members of the community, others that are on the call, if you'd like to send myself an email or a member of my staff, we can definitely try to get that to you to hopefully get that answered. If not, they can definitely reach out to Contra Costa County Health. There's been a number of great websites that have been mentioned and some phone numbers that have also been put into the chat, I believe both in the chat here in Zoom and on Facebook as well. So thank you so much for your time. We really appreciate it.
You're quite welcome. Thank you.
All right. Thank you. All right. Well, with that, everyone, today, that was our main program. And so I want to thank everyone for coming on the call and appreciate your time. And if there's any other questions, any other comments as time goes on, I know there's a number of other issues that have come up in the chat. Those are definitely things that we most certainly want to continue to talk to you about. And please do not hesitate to reach out to me throughout the course of the week. I know that a number of you have already, and those are things that we definitely want to make sure that we get taken care of. So thank you again for your time, and have a wonderful Saturday afternoon.
Thank you. Great information.